My name is Av Rios, and I'm a paramedic with Lansing Mercy Ambulance on behalf of Expert Village. In this clip, we're going to go over long bone fractures. This is my partner, Jacob Barber. He's also a paramedic working for Lansing Mercy Ambulance Service on behalf of Expert Village, and he's going to be assisting us in this. In this clip, we're going to say that he has a fracture to his right elbow. So first thing you want to do is, as we talked about earlier, you want to go ahead and immobilize the limb, keep it from moving. You want to check for pulse. Can you wiggle your fingers for me? And without looking at me, which finger am I touching?
My ring finger.
Ring finger, all right. What you want to now do is turn this over to someone that can help immobilize this and keep it in the position that you found it in. You then want to select an appropriate size splint. Because the fracture is to the elbow, we're going to choose to use an arm splint like this, because what we have to do is immobilize both the lower and upper arm. So while my partner would still be stabilizing the arm, you want to work together to move the splint into position. Make sure you pad any voids that you have. Sometimes there's a little bit of space below the elbow. If you have to, put a little bit of a towel under there. What you now want to start doing is start securing the splint. You want to make sure that you have it in a tight position, however not enough to start putting any pressure on the injury site. I'm going to avoid putting this strap on because that's going right over the actual injury site. Once I have the splint in place, I want to make sure that I've left myself enough room to be able to check for a pulse again. Can you wiggle your fingers for me? And which finger am I touching?
Pinky.
Alright. You now have the limb mobilized. You can now put it in a position of comfort for the patient, and be careful not to cause any excessive movement. This should now reduce blood flow and pain to the patient.